Okay then, well, good morning everyone. My name's Anne-Marie and it's my great pleasure to welcome you to the opening of the 2024 Gathering of Kindness. New South Wales Health has a long and proud history of bringing kindness and compassion into the delivery of care and experiences. And this week, we're going to take time to take a breath, reconnect to our purpose and continue a vital and important conversation. I would like to acknowledge the traditional owners and custodians on whose many lands we gather today. I join you today from the beautiful lands of the Camaragal people and extend my deepest respect to their elders past and present. This land has always been a place of gathering, learning and healing, and a place where kindness, compassion and empathy have long been practiced. As we come together today, let us remember that it is and always will be Aboriginal land. A very warm welcome to all of our consumers, carers and community members who are joining us today. Your lived experience and heartfelt insights bring a depth and wisdom that is truly invaluable in shaping a better, a more compassionate healthcare system for us all. If this is your first gathering, then we feel very privileged to have you join us. And we hope it's the first of many gathering of kindnesses that you attend. Today we come together to celebrate something that is at the heart of healthcare, and that is kindness. Kindness isn't just a word. It's a powerful force that transforms lives, builds trust, and brings healing to everyone it touches. It's probably ironic, isn't it, that we launched Gathering of Kindness on the 11th Remembrance Day. Truth and love have been smacked down so many times before today. Truth is often inconvenient, and love, well, it makes us vulnerable. The world at the moment can seem incredibly unkind. And if you're grieving, please reach out to a loved one. Notice one bright colour somewhere in the day, or as I like to refer it to as a kindness glimmer. A kindness glimmer can be those small, often fleeting moments of kindness that spark warmth, hope, or connection in someone's day. These glimmers might be as simple as a genuine smile, a thoughtful gesture, wearing sparkles, or a few kind words shared in a busy moment. And although they may seem small, kindness glimmers can have a profound effect. They can be contagious in the right way, creating ripples that uplift both the giver and the receiver. The idea of a kindness glimmer is to recognise and celebrate those little moments, like a glimmer of light that can brighten someone's experiences in an authentic and memorable way. This year's theme, Kindness is My Superpower, is a timely reminder of the incredible impact that kindness and self-compassion have in our work. The need for genuine connection and a sense of belonging is greater than ever. When we lead with kindness, we create an environment where people feel seen, valued, and safe, not only as patients or colleagues, but as individuals with unique stories and challenges. Kindness allows us to show up fully for one another, creating connections that break through the barriers of isolation and bring us together as a community. As we care for others, let us also remember the importance of caring for ourselves. Self-compassion isn't a luxury, it's essential to our well-being and resilience. And when we extend kindness to ourselves, we nurture our capacity to bring empathy, patience, and understanding to everyone around us. This gathering of kindness is a chance to celebrate the acts of kindness, compassion, and connection that makes a difference in healthcare. Please let's embrace this week with open hearts, share our stories, and let kindness lead us. 3 years ago, we launched Elevating the Human Experience, an inspirational, and some may say an aspirational guide for transforming the experiences for all of us. But this guide is more than a strategic approach to delivering high quality care. It's primarily about fostering a culture where kindness is a shared value with all staff and volunteers, shaping the way we deliver care and interact with each other. Kindness and compassion has been identified as a key lever of culture and staff experience within the newly published New South Wales Health Culture and Staff Experience Framework, a link which is now being shared in the chat. We were so delighted to see this acknowledgement and continued strategic importance of elevating the human experience. And for those of you who've been on this journey for some time, you will know that this directly relates to Enabler 2, culture and staff experience. This year, we're focusing on kindness in action, a celebration of the inspiring way our teams across New South Wales Health make a difference every single day. Together, we're highlighting the incredible stories of compassion and empathy that truly shape the care we provide and the connections we create. I'm truly honoured and privileged to open this event alongside two extraordinary leaders, our Secretary, Susan Pearce AM, and Chief Nursing and Midwifery Officer, Jacqui Cross. Both Susan and Jacqui exemplify kindness and compassion in every aspect of their work, showing us daily what it means to lead with heart. They don't just talk about kindness, they live it, setting an inspiring example for all of us. And while Susan couldn't be with us in person today, she shared a special message that captures her vision and gratitude for all that you do.
Good morning and welcome to the opening of the 2024 Gathering of Kindness. I'm joining you today from the lands of the Gamaragal people. This land belongs to them, always was and always will be Aboriginal land. I acknowledge elders past and present and all Aboriginal people who are joining today. As I reflect on what the Gathering of Kindness means to me, I'm connected with the lessons learned from those who've walked these lands since the Dreamtime. Lessons about connection and kinship, the foundation of how we can give and receive kindness and compassion as we care for one another. The power of kinship can build thriving Aboriginal communities, supporting one another, just as the power of kindness can build a thriving culture across New South Wales Health. I also recognise and extend my gratitude to the valued consumers, carers and community members who generously share their stories and experiences to help shape system change. Your contributions are vital to ensuring we deliver outcomes and experiences that matter. New South Wales Health is committed to bringing kindness and compassion into the delivery of personalised and culturally safe care. This intentional focus is clearly outlined in Future Health, our roadmap to delivering health services now and into the future. For me, this commitment is beyond a line in a strategic document. As a Secretary, I'm committed to ensuring the culture of New South Wales Health, Australia's largest provider of public health care, is underpinned by kindness and compassion. 10 years ago, we released Small Acts of Kindness. The message at its heart is as true today as it was then. It is the small acts of kindness that can make the biggest difference to all of us, because at the core, we're just humans caring for humans. I know the New South Wales Health workforce is the best in the world. And despite the busyness of doing the task at hand, there are millions of acts of kindness that take place across New South Wales Health every day. The Gathering of Kindness is a week where we can reset our focus, reconnect with our purpose of why we chose a career in healthcare. For me, I began nursing a long time ago, 1988 in fact, and when I think back to why I chose the career, which I'm still very happy with to this day, is because I wanted to care for people beyond my immediate family and friends and to give back to the community of New South Wales. It's certainly a decision I've never regretted, and in everything that I do, it underpins my role as Secretary and how I feel about the work we as a broader health system do, the changes we make in people's lives every single day. I invite and encourage you to join the conversations this week. A conversation that is centred around kindness is my superpower. Shortly, you'll hear how New South Wales Health's strategic focus on kind and compassionate care is being implemented locally in South Eastern Sydney Local Health District, and the impact on not only patient care but on the workforce. On Wednesday, which is also World Kindness Day, I'm excited to be sitting down with Dr. Rebecca Deans, where we talk about kindness in innovation and her work in pioneering Australia's first uterus transplant. There are many other fantastic events this week: the launch of the newly updated Health and Arts Framework, virtual conversations about whether kindness really is a superpower, and we shine a spotlight on Kind Lab 12 months on, and one of the winners of the Kind Side podcast, which truly celebrates kindness in action. Of course, across the state, there are many in-person events in our hospitals and community services. Thank you for your unwavering commitment to caring for the community of New South Wales, especially during their most challenging times. I am truly grateful for each and every one of you and for what you bring to New South Wales Health.
Thank you, Susan, and always incredibly inspiring. So from one inspiring person to another, I'm thrilled to introduce Jacqui. Jacqui, a friend and colleague whose dedication and expertise is having a lasting impact on nursing and midwifery throughout New South Wales Health. Jacqui serves as the Chief Nursing and Midwifery Officer, a role where she provides inspiring leadership on a broad spectrum of issues affecting our health system. Her journey through the public health landscape, from hospitals to local health districts and now within the New South Wales Ministry of Health, brings invaluable experience and insights to this role. Jacqui has long been a passionate advocate for nursing and midwifery leadership, championing professional practice and consistently leading with purpose. With extensive senior management experience, Jacqui has served as the Director of Nursing at the Children's Hospital at Westmead and later at South Western Sydney Local Health District, where her leadership as a senior exec profoundly influenced those teams. In recognition of her outstanding service, Jacqui was this year awarded a Public Service Medal, an honour so well deserved. Jacqui is a true leader, committed to person-centred care and fostering positive, effective workplace cultures that support it. Please join me in welcoming Jacqui, whose career and vision continues to strengthen and inspire just not nursing and midwifery across our health system, but all people. Welcome, Jacqui.
Oh, thank you, Anne-Marie, and that was such a lovely introduction. It's very thankful for that. So hello and welcome to everybody for day one of this gathering of kindness. I'm so pleased to be here with you sharing this opening. I too would like to begin by acknowledging the traditional owners of the land on which we meet today. It's a pleasure to be here on Aboriginal land. I pay my respects to the traditional owners, the Camaragal people, which are the traditional custodians of the land on which I meet with you all today. I acknowledge the distinct culture and the history of Australia's First Peoples, their sovereignty over land and sea and their pursuit of self-determination. I pay my respects to elders and any Aboriginal people that are joining us here today online. So thank you to Susan, always, as you said, Anne-Marie, inspiring and really leading this work across the state in her role that I now sit in 10 years ago. It's hard to believe that was so long ago. And Anne-Marie, again, thank you so much for inviting me to be with you all here today. As Anne-Marie said as well, today is Remembrance Day, so we will be acknowledging that 11 o'clock today with a minute's silence. I'm often asked what attributes I look for in a leader, particularly when people are coming up for job interviews and the like. The thing that I always say, and it's the thing that I always say first, and it's without hesitation, it's kindness. And I think sometimes that we think of kindness as one of those soft skills And it might even sometimes be seen as a weakness, sadly. And if I look at Jacinda Ardern's experiences in New Zealand, where I came from originally, that was quite apparent at times. But for a lot of us, it's the opposite. It takes a great deal of personal insight and vulnerability. And it means that you allow yourself to walk in the shoes of others, seeing things from another perspective. And it's something that you have to actively practice on. And it takes courage and integrity. And it means you don't always get it right. And it is about continually trying to improve and see things differently. And I think about it as a muscle. It's a muscle that you stretch and grow every day. So it is a genuine honour to be here today, this morning, to share stories that really are a shining example of how we all embody kindness through our words, and as we've said today, through our actions each and every day. And I think if we reflect through some of the stories today and in the coming week, we can all think about moments, big and small, that have shaped who we are, how we interact with each other, and most importantly, how we provide care to people. And as you'd expect, as the Chief Nursing and Midwifery Officer, I'm going to be shining a light today or this morning on our nurses and midwives, sharing examples of how we embed kindness at a strategic and operational level, and how that translates in the way that we support our workforce, our workplaces, and the care that we provide at that clinical level, with kindness at its heart. Importantly, we're going to also hear from a consumer about how kindness has coloured their experience of care, not only for them personally, but also from their family's point of view. We've also invited some of my dear friends from Southeastern. I've got to fess up, that's where I first started my nursing here in Australia, and I spent a lot of time working in Southeastern as well. So it's going to be lovely to hear from the leaders from Southeastern Sydney local health districts, who are going to share their insights and how they built kindness into a district-wide strategy, and how they have created space for staff to focus on person-centred practice within a complex healthcare environment. So I really hope that you can stay tuned for our panel discussion with the Southeastern leadership team. I have to share they're going through a spot accreditation as we speak. So it's we're even so pleased that they've actually been able to take the time out to join us today. But before we start with our panel discussion and hear from them about their journey, I've got a very special story to share with you that really does illustrate that enduring superpower of kindness. We discovered the story of kindness as a nomination that was given to us as part of the 2023 Excellence in Nursing and Midwifery Awards. We've got a very important award that we call the Healing Heart Consumer Award, and every year I have the great privilege of reading those nominations, and they really are stories of kindness, how our nurses and our midwives have really touched the hearts, gone that little bit extra for the people that we care for. So this story has been shared from Irene, and Irene nominated Mithra, one of our midwives, last year for the Healing Heart Consumer Awards. It's a beautiful story of kindness. So we're very, very happy to bring that to you today, and I hope that you're going to enjoy it as much as we had. Some of the video content might be a little bit emotionally challenging for some individuals, so I'll just put that up at the beginning. And if it does jolt something for you, can you please just ensure that you get support from those around you? So I think we'll hand over and we'll play the video. Thank you.
Hi! It's Auntie Mithra.
So good to see you.
Hello.
I am a mother of two beautiful children, Jaira, who is now 11 months old, and Naraya, who was stillborn 2.5 years ago.
I'm Mithra Kenner. I am a midwife. I met Irene and Brendan at Nepean Hospital when Irene became an inpatient on the antenatal ward where I was working.
And I remember when we went for our 20-week scan with Naraya, unfortunately we had to be rushed to to hospital because of some complications. You
The
remember?
cervix was a little bit open
Yeah,
and it shouldn't have been.
yeah. And unfortunately, she was stillborn at 22 weeks and 2 days. And I remember that was one of the hardest and darkest times of our lives. But you were there, caring for us, showing us kindness every single step of the way. You treated us more than just a patient. You treated us as people with a story worth listening to. And I really appreciated that about you.
It's easy to dial up that kindness into a superpower and really make a difference in the way that you care for someone, in the experience that they have.
When it came to your care for us, the thing that stood out to us most was those small acts of kindness. For example, you didn't just stay at the door. You know, you came in, sat on the end of the bed,
Made myself comfortable.
that's right, made us a cup of tea, brought us extra sandwiches. And because you made that time to make a connection with us, we really felt safe. And so when it came to the hard stuff, when it came to asking questions about what would it be like to give birth to a real premature baby, we felt safe that we could ask you those questions.
That's so good. I'm glad that those little things made such a difference and went a ways to making you feel safe and building our relationship so that we could have those honest conversations. I think that honesty is kindness when it comes to supporting women and their expectations of pregnancy and birth.
And when I look back at our season of pain and grief and joy and excitement and life, we were able to experience Mithra's kindness yet again. And kindness meant that I was reminded that I wasn't alone, that I walked this journey surrounded by people who loved and cared for me. When I think about beautiful Naraya and how, even though we weren't able to save her life, I'm really thankful that kindness was the superpower that brought into this world the life of my beautiful baby boy, Jaira. And now Brendan and I have the wonderful privilege of being Jaira's parents, and we owe that to the kindness that Mithra showed to us.
So my sincere thanks to Mithra, Irene, Brendan and Jaira for sharing their story. And I think a real example of really what walking alongside people really does mean, and the difference that can mean in some of the toughest times, but also in some joyous times as well. We often talk about the outcomes that matter to patients, and I'm sure you'll agree, it's all about the small things, the kindness expressed through words, and even sometimes without those words, through our actions that matter so much to those that we care for. So now it's my very great pleasure to hand over, or actually to introduce the team from Southeastern Local Health District. I have to say it's pretty challenging. We're all in different places, and even though we've been through this for so many years now, it still feels a bit odd when we're not sitting in a room, particularly when we're having a facilitated conversation. But we'll all try our best, and I'm sure we're going to have some great discussions and some insights. So firstly, I would like to introduce Fiona Zhang, who is the consumer representative, who will be part of the panel, and as I said before, sharing some of her insights as well. Kate Hackett, the District Director of Nursing and Midwifery. Hello, Kate. It's lovely to have you here and giving us that overview around the strategy. Karen Takeri, the Director of Nursing from the Prince of Wales Hospital, and Dan Shaw, Nurse Manager for Strategic Priorities in the Patient Experience. Simone Payne, our midwifery and nurse manager for the Women's and Children's Health Services at the Sutherland Hospital, and Michelle Brady, a nurse educator from the Sutherland Hospital as well. You'll see on screen as we spotlight, there's some of them joining together in a room, and others are here like me, sitting a bit separately as well. So it's just wonderful to have you here. So as I said, thank you for joining me today, and I'm really looking forward to hearing how you have brought kindness and compassion to life in southeastern Sydney through your strategy transforming person-centred cultures. So first off, Kate, I'm going to put the spotlight on you. Can you briefly just tell us a bit about the strategy and which you've called our strategy for transforming person-centred care?
Yeah, thanks, Jacqui. Look, good morning, everyone, and it's such a pleasure to be here as part of the Kindness Week celebrations and to showcase, I suppose, the great work that South East Sydney Local Health District, and particularly, I suppose, representing nursing and midwifery today, what we're able to share with you guys today. So, as Jacqui started to mention, our new strategy provides a roadmap to our future. It learns from the past and draws on the views of many of our nurses and midwives in shaping the future direction for nursing and midwifery within our district. I think without doubt, the last few years have demonstrated the ability of nurses and midwives to display strength, capability, compassion, and the ability to work in ways that put people at the centre of everything that we do. The Nursing and Midwifery Leadership Team started on reimagining the new strategy in 2021, and it was actually the year prior to I started at the district, and it was led and supported very much, very capably by Karen and Dan, who are on the panel today as well. So they can add bits that that were even before my time. The development of the strategy has provided the directors of nursing and midwifery in our district, as well as the wider nursing and midwifery leadership leaders, the opportunity to acknowledge the many achievements that have been made possible through the implementation of our previous strategy, which was called Journey to Care. An important focus of our new strategy was for the focus to shift from just care of the patient and client and how nurses deliver that care in a person-centred approach. So what we've really done is that it's about the human-to-human connection, including a focus on collaborative relationships. We really wanted to focus this on, it's not about just that patient nurse or midwife relationship, that we're all people, and this is wider. It includes our patients, our carers, and also our relationships between ourselves as nurses. We will provide compassionate and respectful care that prioritises the unique goals, expectations, and experiences of each person as we develop healthful cultures where people are at the centre of what we do, and they're supported through those collaborative relationships, leadership, and innovation. The strategy was reimagined through the lens of the person-centred practice framework, as Jacqui mentioned. This framework was developed by Professors Tanya McCants and Professor Brendan McCormack. And very fortunately for our district, since 2021, Professor Tanya McCants, a recognised expert in this field, has been engaged to work alongside our nursing and midwifery leaders to commence us with working on the new strategy. The approach to developing the strategy was underpinned by the principles of collaboration, inclusion, and active participation. This was a process aimed on building consensus, beginning with our directors of nursing across our district, followed by a large range of engagement events with our nurses and midwives. This enabled a diverse range of stakeholder groups to shape the overall vision and the strategic plan and priorities for nursing and midwifery for the next 5 years. Our strategy, which is transforming person-centred cultures, is aimed at delivering person-centred practice to our community. The strategy acknowledges the influences on nursing and midwifery practice and the need for our care to remain responsive within a really complex and challenging healthcare environment. Through our journey, we redefined our purpose statement and our values. This was a really interesting exercise that we undertook. Our values as nurses and midwives in our district remain very much unchanged from our previous strategy from 2015 to 2020. They were 6 values. They were care, integrity, innovation, influence, inspiration, and respect. But interestingly, with our work with our nurses and midwives, we added a seventh value to this strategy, and that was the value of courage. So this value is about us being brave and leading through our voice and also our actions, which I think is really timely when we're talking about kindness. So following on from our purpose and our values, we identified 7 key priority areas. Each of these priority areas has a corresponding set of strategic actions, which provide the focus for action planning at the district, organisational and team levels. The 7 priority areas address different components within the person-centred practice framework. We believe, however, that the sum is greater than the individual parts, and with approaches that ensure inclusion and collaboration, it will be the roadmap that leads to the creation of healthful workplace cultures. Also, a very important part of our strategy is that we aren't doing something radically new. We're building on what we have and all the great work that's already been undertaken by our nurses and midwives. Throughout our strategy document, we also placed in there some best practice exemplars for each of the priority areas. It really brings, I think, the strategy to life and demonstrates the compassionate, kind and person-centred practice already in action. So I think that's probably sort of the overview, Jacqui, on our where we got to with building our strategy.
Thanks, Kate. I've asked you to condense something in a very short amount of time. I guess the things that stood out for me when you're talking about that too is, I like the fact that you said you're not, you're building on the foundation that has already been in there. And I think tapping into the values and the way that we work together as nurses and midwives as well. I'm just interested as well, Kate, I'm going off script, so sorry, as you described that, I think what you described too was bringing people together and building something together. So oftentimes the strategy itself is very important where you end up, but it's the process of bringing people together to examine something like kindness, about person-centeredness. Can you give us a few little insights into that and I guess how valuable that process was?
Oh, look, I think the process was incredibly valuable. I mean, the strategy took probably almost a bit over 2 years to bring together. And I think as I touched on, during that time we brought together large amounts of people. So we had, engagement with over 200 different nurses and midwives. We received over 3,000 bits of feedback during our work. So I think, obviously how we managed the drafting and the working up and working through of the strategy and the reflection on the work we've done really, I think, brings us together as a team and with those values. And it really puts in perspective, as I said, I think the fantastic work that we definitely already have underway. And I suppose that vision and I suppose coming together as those professions and, for our district, that's, over 5,500 nurses and midwives, but having that shared values and vision and priority areas really, brings that team together with that shared purpose.
Yeah. Thanks, Kate. I think, as I said, but focusing on how much you engage people in the work and allow them to explore is such an important part of it becoming part of what we do. So just interested too, just on that, Kate. Given that you sit in that strategic level at the local health district, how do you show kindness in your leadership at that kind of level?
Yeah, look, I think as you sort of mentioned at the start, Jacqui, kindness isn't for me just a nice to have. It's actually a fundamental aspect of being an effective leader within an effective healthcare setting. And I really believe that, kindness is not a soft skill. It's quite the opposite of that. And I think, particularly working in health, not just being a leader, but also working in health, the importance of kindness so incredibly important in everything we do. And I think as a leader at a district level, but at all levels within particularly the healthcare setting, we know the impact kindness has on our patients, on our staff, and on our community. And I think, we know that kindness and empathy significantly impacts the patient's recovery and their overall experience. We know that when patients feel cared for, they're more likely to follow the advice that's given to them by nurses, midwives, their medical staff, and allied health staff. And that leads to better health outcomes. And, so I think as a leader, it is so pivotal to display the values that you want to see in all levels of your organisation. We know that kindness fosters open and honest communication. And, we see that, at a patient clinician level where, if that they're shown kindness, the communication flows, they share important information around their symptoms and their concerns, and they feel respected and understood. We also see that within our teams. So, kindness is really about that open communication, being honest. We know that kindness reduces stress. We know that kindness is the cornerstone of trust, and that's trust obviously between staff, between myself and my directors of nursing, between the nurse and the patient, between the midwife and the mother. So it promotes teamwork, and it leads to a positive work environment. So we are very proud of our nurses and midwives that work within our healthcare settings here at South East. And I think we all know that showing kindness leads to job satisfaction, leads to those better patient outcomes, creates teamwork, and creates that positive environment that that we really want our staff to feel that they're within and obviously stay within working in that health service.
Thanks, Kate. And there's the personal, and then it's so important to have a strategy that makes that direction explicit, and showing that it is valued and part of the priorities for what you do within the district too. Right, I'm going to hand over to Fiona now. And Fiona, thank you so much for taking the time today to be with us. So big welcome. Could you maybe share with us from a consumer perspective? I'm really keen to hear from you about what kindness looks like for you.
Yeah, thanks, and good morning, everyone. Thanks for having me come along. And I guess I just wanted to say, first of all, thanks for everyone who's here. You guys do such amazing work. Thanks for your dedication, compassion, resilience, and hope you show kindness to yourselves as well. So I think from a consumer's perspective, kindness is about being seen, being heard, being respected at every stage of care, especially during the more vulnerable moments. It's about the little things that go beyond like that medical expertise and technology. So it's human touches that make us, as patients, feel cared for as whole people rather than like a number or a case. And that's what makes a difference between care and caring in my experiences. I think it's about patience. When you're in a busy hospital setting, when time is limited, when staff take a moment to listen without interruption or really show empathy for my concerns, even the little things, it can really be a bit of a lifeline in a stressful situation. A lot of times I feel really uncertain or anxious because I don't fully understand, the medical terms or the process that I'm going through, or what division I'm currently interacting with. For example, I remember a time when things were progressing, very fast. It was very unexpected. My nurse took us aside, calmly explained to me and my family and my loved ones just what was happening, what to expect next. And they took the time to really explain things in a really simple, reassuring way, using language that I understood, using this shared understanding and language. Pause to ask questions if we needed clarification, getting back to us about our requests, saying things like, I can see you're feeling anxious about the procedure, and that's completely understandable. I'm here to help. Let's talk about what's happening next. And that presence really made a huge impact. That steady reassurance about, what was going to happen really helped me stay grounded during quite a distressing experience. Even small gestures like holding my hand, making a cuppa, all of that just calmed my nerves and made the experience a bit more bearable. I think through kindness, you build really strong relationships in short periods of time. you build trust not only with an individual, but you start to build trust with the team, with the process, with the system. And that sense of kindness that you see between health staff and consumers and teams gives you something to look forward to, especially if you frequently seek support from health services. Like, I remember a time when after screening, I had a quite a bad experience with screening. The nurse sat down with me just for a few minutes just to check in emotionally and not just physically. Like, she didn't rush through the routine checks, but really took the time to sense out how I was feeling. That made me just feel, like I had my, she paid full attention to me, and I've made me feel like I really mattered. And I think the other part of kindness is recognizing everyone's individuality and preferences. It's not about assuming, but really asking what makes someone feel comfortable, cared for, because we all present to health with a lot of different reasons, but also a lot of different preferences. When a nurse asked if I preferred a certain temperature in the room, or if I wanted a pillow placed in a specific way, felt like they were taking like an active interest in my comfort and not just checking off tasks. And that small acknowledgement of agency made me feel like I had a bit more control over my own health and over my own care. I guess another part is also just, it's about being kind even when things don't go perfectly. When I mentioned at the start that experience when my health was kind of progressing in ways that were quite unexpected, it's that kind approach really can make a huge difference. It doesn't erase the fear, but it helps to manage it. And sharing that vulnerability, having a laugh, that makes you feel so much less alone. It's easy to be kind in more positive situations, but when you're afraid, when you're vulnerable, when you're really in shock, when you're distressed, when complications arise, that's when that small act just makes the biggest difference in the world. And I think, just to kind of sum up it a bit, it doesn't make the experience more pleasant, but it makes it an environment where I feel comfortable asking questions, expressing my concerns, being more involved in my own care. And it's not really something that can be measured, but it's something it's more felt in heart and mind. I think that's what the essence of kindness and health is really that's what it is as a consumer.
Thanks, Fiona. That's really very thought-provoking. I'm sitting here reflecting around my time when I was sort of on the clinical floor as well. And I think it really reflects what Susan said earlier around we're humans connecting with humans, doesn't it? And it's taking the time to really understand where you're coming from. And I'd like that message too. It's not just about when things are going well. It's also very important when there's tougher conversations to be had and situations that are a little bit more challenging as well. So Fiona, if you could reach out to all of New South Wales Health and all of our nurses and midwives, what is the number one thing that you would ask them to do to make a positive impact on your experience or other people's experiences?
Yeah, I think just kind of also, I think I probably expressed a bit in my previous response, but just really consistently taking the time to listen and truly hear, patients, whether it's their concerns, their worries, or maybe even their achievements. I think in health, it's often known as a really fast-paced environment. Sometimes as patients, we might feel like we're just another number or another task on the list. But when, staff really actively listen without interrupting, without rushing, they create a space where we feel really valued as that person. There's that human-to-human connection, as mentioned. And I think listening is more than just hearing words. It's about tuning into like the underlying, emotions, concerns, even the context that can influence someone's health experience. It might be something as simple as, asking how you're feeling today and really waiting for that answer, not just rushing through it. Might mean acknowledging, I guess, the emotional weight of what a patient might be going through. It could be anxiety over diagnosis, fear of the unknown, really acknowledging and taking into account all the factors that kind of led to your interaction with them today, but also their interaction with you. I think I remember one nurse when I was feeling really overwhelmed and anxious during my recovery, they just simply asked, what's been the hardest part for you today? That question really invited me to share more openly, and it kind of shifted the entire tone of my experience. I started talking about my day, but also opened up to other parts of my experience, and they listened, respected my perspective, while I shared concerns that might not have been immediately obvious, and that led to a bit more of a personalized approach. I think it wasn't just about physical care, but just meeting me where I was, both emotionally, mentally, made me feel more supported and less isolated, and it helped me reflect on my achievements and progress and take the focus elsewhere, which is really helpful. I think also a component of that is part of kindness is really doing an act without asking for something in return. Whether it's, when I was lost, helping out with directions, walking together with the health staff, having a chat along the way, whether it's a staff noticing me feeling a bit unsettled, asking if I want to go outside for fresh air. That was their time that they took out of their day to help me to arrange these supports, and also, communicating with other staff once, even after I've just discharged from service, for example. So I think it's just really being present in that moment and presenting to a patient with full attention and empathy, and that can really ultimately create such a big difference in how someone feels about their care, but also how they heal, as well as you mentioned earlier, that power of healing from kindness. Yeah.
Thank you, Fiona. That was just there's a gem there around being in the moment, I think, and really engaging in a meaningful way. So some really, really important messages there, and I think they'll just keep going through the rest of the week and, well, further than that. But thank you so much for sharing those insights, Fiona. So on to Karen. Karen is the Director of Nursing at Prince of Wales Hospital, and we're probably going back to the strategy as well. Keen to hear about how you brought the document to life. So we're looking at that sort of operational lens, a strategy getting into these sort of operation day to day. So how you brought that document to life in the way that you lead nursing and midwifery services at Prince of Wales Hospital, and probably more broad than that too.
Thanks, Jacqui, and good morning, everyone. It's lovely to be with you this morning. I think Kate already framed it up beautifully, where she raised the fact when we developed the strategy, we spent a significant amount of time in an engagement phase with all nursing and midwifery roles across CESLID, but also with our consumer partnership committees as well. Also had an opportunity to review it. And we did this really purposefully because we felt it was important for nurses and midwives to be able to see themselves in the strategy, if you like. And so getting the language right, being challenged by what we actually meant by some of the statements, so that it wasn't just going to be a document on the shelf, but something people could see themselves in and really appreciate how they're contributing to us providing safe person-centred care and developing cultures that supported care for those receiving care, but also supporting cultures for those providing the care. So that component was really important, because when it came down to the facility level after the launch last November, people already were aware of it because they'd had an opportunity to comment and provide feedback. So for us at Prince of Wales, what we did is we spent a number of months actually in spaces where we started to workshop and facilitate conversations and develop a shared understanding of person-centeredness. What was it? What did it feel like? What did it sound like? What were our hopes for safe person-centered care and the culture that we wanted to really be a part of? So this involved, sharing not just the strategy, but then opening up discussions around, well, what is person-centered practice, and articulating that, capturing that group after group. And the other question we used was, how do we know we are delivering person-centered practice? How do we know we're compassionate and kind, and capturing all the different ways at the moment we get feedback or evaluation of the practice, and how do we articulate as nurses and midwives the difference we make in practice? So we captured that as well. And I did that at RN and EN forums, our clinical nurse specialist forums. I took it to obviously our CNC, CNE and NUM groups, who are also part of those sessions more broadly. I spent a lot of time with our executive, our nursing executive, where we also unpacked those questions with a facilitator. But we went another level in that we actually explored, well, as a nursing leader, what are we doing at the moment contributing to our 7 priority areas already? What am I doing in my day-to-day that actually I feel I'm already working in this way, or already working towards that priority area? So I think that was also a way of us really embedding ourselves in the strategy to understand as a nursing executive collectively what we're wanting to achieve here. And what are some of those measures? How do we use those feedback mechanisms? How do we capture human experience, patient, family, carer and staff experience, and use that to inform our quality and safety and improvement work? How do we use it to inform our education? And then most recently around our research strategy as well. So it sort of has had a number of things flow from it. We've also unpacked, Kate mentioned the 7 priority action areas, which we as a group of directors of nursing across Cecilid and the leaders of the district sat with for a number of months, thinking about all the different contexts in which nurses and midwives provide care, and thinking about what are those priority areas we need to invest in and look at. And so at Prince of Wales, we've mapped all of the work we currently do against those 7 areas. And it was a wonderful way to celebrate and acknowledge how we are just moving in that direction of creating cultures that are putting people at the centre. But what it also did was enable us to identify some gaps and think about, well, what are we going to do about that? How are we going to approach that differently? And how do we need to now turn our attention to that priority area and unpack that? And I think using the person-centred practice framework as a theoretical underpinning of the strategy enabled us to take stock of some of our program work and, thinking about, well, how do we work with beliefs and values? How do we, support being present and in the moment? How are we, what processes are we putting in place around shared decision making? How do we facilitate and support choice for people to make choice about their treatment or their decisions with their healthcare, but also choice for nurses to around their development and their professional careers. So, looking at choice was important, and then working holistically. I think we really needed to look at some of the feedback that we'd received and look at, are we truly doing this, and really having some really critical conversations around that and challenging ourselves as well at times. So it's been a few different things. I guess at Prince of Wales, we've also just recently completed each of our teams. We have 41 clinical nursing teams, and it's spread into the multidisciplinary space. But we've recently revisited all of our values and vision statements for safe person-centred care here. So we have a lovely collection of 41 statements that are very much at the team level, which the teams have developed through a facilitated process, and they've started to articulate what's important to all people, patients, family and staff. So I think there's some of our things that we've been doing this year.
Thanks, Karen. And it sounds very much like a document that is living, and what I'm hearing from you is that people are actively engaging in that. It's sort of your compass, isn't it? Having those conversations and being, as you said, in the moment as well. A few things there too: the theoretical framework that underpins the thinking, engaging your executive, your nursing midwifery executive into those, nursing in your case, executive into those conversations and measuring those outcomes and continuing to do that. I have to say, you're probably going to be okay with your spot check today, Karen.
I hope so. I think so.
I want to jinx you. So Karen, when you think back, what are you most proud of when you reflect on the work that you've undertaken to actually make this alive, I guess?
Look, I feel really privileged to be part of this work. I'm really proud that as my peers, like all of the directors of nursing and service directors across our 8 hospitals and district services, have all come together. And, we often sometimes can work in a little bit of a silo, but not in this case. We've really, over the last 2-3 years, we've come together and embraced each other. We've really started to develop a shared understanding about what human experience is, what is person-centred practice, and we're able to critically reflect and offer different perspectives with each other, which professionally I think is really important, where we can learn from each other. I think, I'm really proud that we have a strategy that puts people at the centre of it, and it is based on respect, it's based on kindness, it's based on civility, and it's based on having a shared understanding and being really purposeful in our practice around how we connect, and it's all about relationships. So, I think I'm really proud. I'm really proud to lead the strategy here at Prince of Wales, and I think it's an experience that I've never had previously, where a group of directors of nursing have such high levels of collaboration and inclusiveness together.
Thank you, Karen. If we have time later, I might circle back and ask some other questions. Could talk about this all day, as you know.
Thank you.
So, thank you. Dan, I'm going to hand over to you, but I'm going to give you a bit of a pre-warning because I will need to, at 5:59, we'll take a bit of a break. But I might start off by getting you to introduce yourself and sort of explain a little about what your role is, and then talk about in that role, how have you seen the strategy come to life?
Wonderful. Absolutely, Jacqui, and good morning to you and good morning, everyone. It's really wonderful to be here with you all this morning, and this is one of my favourite weeks of the year. I absolutely love everything kindness, so it's wonderful to be here having this conversation with you all. My role here at Southeastern Sydney is strategic priorities and patient experience. And I guess what that looks like on a day-to-day basis varies, which is really exciting. I get the privilege of working across our entire LHD with clinical and non-clinical staff across a range of different priorities, both within the nursing midwifery portfolio, but more generally in the patient experience space. So working with our clinical teams around really how are we elevating the human experience for our patients and for our staff? What are the key pieces of work that we have underway? How can we do things differently, and how can we enhance what we are already doing? And I think that's something that Kate mentioned earlier this morning, that we have been in this space of working in person-centred ways, and our strategy really highlights examples of how we do that. I get to speak to a lot of consumers, patients in the work that I do, and read their feedback and hear from them, which is really exciting because that gives us an opportunity to be curious about the work that we do and how we can do things differently. One of the greatest journeys I think I've been on in this role is the development and implementation and ongoing work around this strategy, particularly being at the side of Karen all those years ago, working together to really understand the vision and develop a strategy that really spoke to what we felt collectively was needed to set the direction for nursing and midwifery within Southeastern Sydney Local Health District, and underpinned by the wonderful person-centred practice framework that really at its core is about enhancing human experience. So it's a really wonderful strategy where we're working across the LHD at the moment, implementing and embedding the strategy across our sites and services. And I guess in my role, seeing it come to life from that very first conversation that we had back in 2021, and working at every stage of that journey to see the collaborative, inclusive, that participatory approach with our directors of nursing and midwifery coming together to really define a strategy that was underpinned by the 7 values, those shared values as a group has been incredible. And then at each stage, seeing it grow and develop. I often think of that little cartoon infographic where you've got yourself over here and the mountain there, and that's the end of where you need to be. And it's not linear. It's that circling back, and it's a bit of chaos in the middle to get to where you need to be. But certainly through that process, we've landed with an incredible strategy, and it's great to be here today to share that with everyone.
Dan, perfect timing as we just move into commemorating Remembrance Day. So on this day at 11 a.m, Australians and pause in silence for a minute to remember the bravery and the sacrifice of the people who lost their lives while serving Australia and its allies in wars, conflicts and peace operations. And I would also like to include our nurses who have been lost their lives in those times as well. So now time to reflect and silently remember all of those who have served and died in war. They shall not grow old as we that are left grow old. Age shall not weary them, nor the years condemn. At the going down of the sun and in the morning, we will remember them, lest we forget. Okay, thank you, Dan. And if I get an opportunity, I'll ask you some further questions later on, so you're not off the hook yet. So,
ladies and gentlemen, I would like to show my respects and acknowledge the meeting takes place, and to the elders past and present.
sorry, we've got something happening here at the ministry as well that's just coming through. Okay, we might just carry on. Sorry about that. Simone, just handing over to you now. Simone, so you're a midwifery manager.
Could I please ask you to stand? They shall grow not.
Let's muddle through. They're commemorating here in the ministry. They're a little bit later than we were, so sorry for that disruption. All right, so Simone, just introducing you as the midwifery manager from Sutherland. So how do you think this document comes to life for mothers, families, and for midwives as well? Keen to hear your view.
In all honesty, for us, it's not a new strategy. We've been focusing on woman-centred care for as long as I can remember. It was ingrained for me when I was a midwifery student, and it's continued on from there. But what the strategy does is it explains why we do it. So there's certain aspects of the care that we provide every single day, and we do it because we place women at the centre of the care, the women and their family, whatever their pregnancy journey may be or what their pregnancy journey has been. But this strategy sort of gives us guidance on why we do it, and focuses on what we're trying to achieve as midwives, providing care to women and their families. The other thing it does is it demonstrates the amazing effect that kindness has on our staff. So I think as midwives, we often we always place women at the centre of the care, but the staff don't always get that same focus. And this allows us to not take away anything from the women, but also to show kindness to our staff and see how they can grow and foster from that, and as well then the effect that has on the women that they're caring for as well. We do it. We show. Sorry, I'll just restart again. I think when we show women kindness throughout what we do, and over the years we've changed what that looks like. So it used to be that we had models of care that you could see 7 or 8 different midwives at different times, and now we try and ensure that one woman sees one midwife throughout the continuation of their pregnancy. That's kindness in itself. It means they don't have to retell their stories. They don't have to reshare their histories. And if we have a really strong handover of care, it means that they never have to retell that story again after that initial telling. So there's a trust that we ensure that the women have. For the staff, it means that just showing their kindness by it might be saying, this is a really difficult case and, you know, you're doing a really good job here. That empowers them to continue on with what they're doing. So even though we've been doing it for a long time, it gives us almost the power to keep going with it as well.
Simone, and I think you talked to, there's a couple of things there, isn't there? It's about, how we deliver care and the models that we use, and we come back to being person-centred, because oftentimes we deliver care in ways that suits us rather than the person in front of us. So the continuity care models that you described there are a really great example of how midwives really do support women in the kind of care that they would like. Be interested to hear a little bit more too around that important factor of supporting kindness within the team and for the midwives themselves. Are there any other strategies that you've put in place as well? You're growing on what was already there?
Yeah, there is a lot. So we introduced the mentoring and midwifery program as well, and that's been a great program in supporting the early career midwives as they come into it, and also, you know, for more experienced midwife, it really gives them a purpose to share their knowledge and share their learnings with less experienced staff. And like I've said this before, but I really can't wait to the mentees become the mentors, and we can continue to see that pattern. I think the other things that we can do is things like the mid-pit pathway as well, when we're really sort of supporting growth and leadership across all levels, but particularly midwifery focused as well, because it is a sort of smaller area within nursing and midwifery, just as important, but it's smaller in numbers and different things. And the pathways themselves really support leadership and growth across all areas.
Thanks so much. I just need to declare that I didn't actually preempt this by making you talk about things that we've been doing from our office, but it's really lovely to hear that particularly the mentoring and midwifery is having an impact in supporting midwives. And I think coming back to what has previously been said, it's about providing a framework where we can have the conversations, make the time to really listen and understand things from a different perspective. So it's lovely that that's being part of the way that you're delivering that strategy as well. And I think another important message there, that whatever strategy you have in place, it's actually about thinking about what other things that are occurring that actually support that focus as well. So thank you. Okay, Michelle, we might move on to you. From a nurse educator point of view, how do you see this coming to life, and what does it look like for you in your role?
Well, it's, I think, coming to life in a very exciting way, in lockstep with some other initiatives across the district. So the Heart of Caring framework is being used to help roll out the strategy across the different sites. And part of my role is running the orientation program. So we start talking about that in nursing and midwifery orientation, setting up the expectation that when they join their teams, that they'll be part of that, working towards how to implement the strategy in their ward and unit, how to work out what their mission is and what their goal statements are, and how they're going to actually do that day to day. What's the action around that? I'm also involved in the Compassion Lab program as well, and I think the really exciting thing about Compassion Lab is it's very much in lockstep with our new strategy, and the very exciting thing is that we have a multidisciplinary group in the room when we do Compassion Lab. So not just clinicians, but at times administrative staff. We haven't managed to attract any cleaners yet, but I'd love to get them in the room as well, because they spend a lot of time with patients and families as well. And in the Compassion Lab, we have a chance to talk about, you know, the stress of the workplace and how to ameliorate that. But we also talk about what compassion actually is. We talk about how to actualise that. We talk about what happens when compassion's not thin. So we explore some of the evidence around the impact of instability in the workplace on how teams function and how that impacts on patient safety and the quality of care, which I think is a way of demonstrating just how important kindness and compassion are, not just towards patients, families and clients, carers, but also towards our colleagues. And not just to the colleagues in our particular team, but the broader healthcare team as well. We can see that lack of stability often impacts on critical thinking and the capacity to make good decisions, good diagnostic skills, and so really impact on patient safety long term. And importantly, in the Compassion Lab, we talk about self-compassion, and it's one of the four, those are the four modules. But that fourth module, I think, is really important to allow our staff to recognise that the way that we care for ourselves and we care for our colleagues is as equally important as the way we care for our patients. And that if our staff don't feel cared for and feel safe to speak up, you know, we lose all that stuff around psychological safety if they don't feel safe to speak up, that we have trust and equity within our groups. and that's a really critical component of safe person-centred care. I think using the person-centred care framework for the strategy was really critical. In my nursing orientation, I actually walk people through the nursing strategy, all the layers, not just the healthful outcome in the middle, and talk about their impact and how they can contribute to those different layers. Because I think even though the clinical stuff we talk about in nursing orientation is really nursing and midwifery orientation, I've only had 3 midwives this year, but I can't forget them. The clinical stuff we talk about is really important and critical to day-to-day functioning, but also we need to set up the cultural expectation in the organisation that we are kind to each other, that we do behave with compassion, and that we work through the person-centred framework. I've even gone to, I make name tags for all the staff who come to nursing and midwifery orientation with their name and where they're going to work. And what I've also done too is use the 7 values from the new strategy and made them into action statements. So, for instance, it might say Michelle embodies care on their name tag. And it was nice to see with the new grads at the beginning of the year that that actually turned into kind of like an icebreaker while they were waiting to start their class, because they were gathering together and comparing name tags and talking about the strategies. And I tell them that what's on your name tag comes from the nursing strategy, so that they know going into their employment that's what they need. So I think it's very exciting. I've been nursing for a bit longer than 6 years. And and when I first started in nursing, it was very much we didn't really much care about the stuff, or not implicitly. We didn't talk about it. People looked after each other, but it was very much a just get on with the job kind of approach. And now we're in this wonderful stage of pulling the care for the staff and the care for the patient, the client, their families, and carers all into the person-centred framework, and I think that's joy.
Thank you, Michelle. You managed to get quite a lot of insights there into a very quick message. So that's fabulous. And I think, again, we just see that being explicit about what our values are and why we're all here. Really, sometimes we think it's all going to happen by osmosis and expect everyone to tie into line. But I think being explicit, having those conversations, and some very practical things there around helping to develop that human connection, particularly for people who are just first entering our healthcare system as well. Just so important. As we start to wrap up, I think I'm going to see if I can do a round, and I'm going to ask you all a similar question. I think I've already asked Kate, but Michelle, can you just give us a quick example of how kindness has made a difference to yourself and to your team?
Oh, look, I'm privileged to work in a brilliant team. It's not very big, but there's a great deal of trust and equity and having each other's back. Just recently, my sister had surgery, and it was not life-threatening surgery, but it was difficult, and I was quite anxious about it. She was on the table twice as long as she should have been. But my team were like, well, what can we do to help you so that you can get off on time and go and see her in the hospital, because she was several hours drive away from where I work. And that's sort of fairly commonplace, that kind of consideration. And it just makes it a joy to come to work in.
Thank you. Dan, what does kindness in leadership look like to you?
Thanks, Jacqui. I think kindness in leadership looks different to everyone, but I think it's really about, for me, leadership, in leadership, finding the kind. And we often talk about kindness being weak or not strong, but I think that if we go into every interaction, whether it's to have a difficult conversation or whether it's to uplift somebody, to celebrate, acknowledge their work or their achievements, it's about how do we find the kind. And what I mean by that is, how do we put that lens of kindness over what it is we need to do? Because purely role modelling that in itself supports others in their development and supports others to be able to take that approach in their own journey. So I think, as I said, it's all about finding the kind, and rather than focusing on what we think, treating others like we'd like to be treated, it's about taking it one step further and treating others like they'd like to be treated. I think is really important as a leader.
Thanks, Dan. Simone, really interested to hear in your leadership. How does kindness manifest itself on a daily basis?
I think to me it sort of manifests in time. So it's someone giving me the time to listen to what I'm saying, or me giving them the time to speak and hear what they're saying as well, and not just rushing in with a response that's reactive and not taking the time to hear what they're actually saying. So just people giving me their time is a privilege, and I need to treat that with respect. So yeah, it's how I use my time to best help meet their needs. And it plays back as well. So I know when, as an example, I recently went up to our director of nursing store and knocked on her. I knew she was really busy, and I went to ask her a question. Then she said hello, how was your weekend, and gave me that time that changed the whole conversation. So yeah.
Thank you. Fiona, I'm sorry to put you on the spot a little bit. If you were sort of to think about what are some of the things how nurses have actually developed that space, like made time, what are some of the things that you've seen them do? So you got any thoughts around that?
Yeah, I think that's a bit of a tricky one. As I mentioned earlier, my experiences, working in the house, understandably, it's a very time-sensitive environment. And so I suppose, when nurses, when all health staff provide that maybe sense of transparency as well, and kind of, setting those expectations around those kindness, and there's even small gestures that they can provide. So for example, if they don't have time at the moment, maybe just, prefacing that to the patient and their family, providing an alternative if possible, all of that. I think that just shows that they care, even when they might have other things on their plate at the moment in that particular context, in that particular environment, but they still are able to show some kindness to the patient and their family. I think that's really important to hear. I think for me, kindness really shines through when you can really see the passion they have for their work, and you can really see their purpose and their intentions. And so sometimes even when there isn't much time to spare, those small gestures that can really make a difference. But that's just my experience, and I think there are so many different ways you can show kindness, whether it is maybe even a small message, even a small message on a card, having staff I guess really share those, having that like shared moment of vulnerability with a patient, that can all really contribute to that really supportive experience for a patient in health.
Lovely. Thank you, Fiona, and sorry for putting you on the spot. Karen, finally, I think I asked Kate the question when we sort of opened up earlier, so you might be expecting it. So can you tell us, how do you demonstrate and role model kindness in your approach, in the way that you lead? And then I guess too about engaging, you spoke before around your nursing executive team as well.
I think it's really for me, it's about civility. And so I think, never walk past someone without having eye contact and acknowledge them and saying good morning. A smile can just do so much. And I recently received feedback from one of our clinical support officers in the coffee line that said, you have a beautiful smile. And I was like, oh, you came into our ward one day and you just smiled at me and you said, how are you? How's your day? And you didn't know what was going on for me, but there was so much, and you really brightened my day. And, you don't actually have to do a lot there. It's about just being present, acknowledge the person or people in front of you, and just asking a simple question. How's your day? How are you? And using those skills around observation. I mean, with my team, immediate team, it's observing the nuances and changes, in some of their affect, and just, having a gentle word with them. Is everything okay today? Is there anything I can do to support you today, or what's happening? So, and that often generates a conversation which we can get into. So I think it's really, for me, it's about being present and being really connected. And the second question was around the nursing executive.
Yeah.
I think it engaging them in, and developing relationships with each other, so that they do have quite complex and sometimes busy roles where they are have multiple priorities, but it's about forming the relationship. So we've done some work around, what does that sort of effective relationship look like? What's it based on? What does support look like? And asking each other, because it can look very different for different people. So we've actually started to define that as a nursing exec, and knowing each other's strengths and sort of those areas where we want to focus on, and knowing that each of us has something to offer, and it's how we come together as a team and draw on each other's strengths and appreciate that we all are going to have some ups and downs, and how do we self-monitor that, and as a team, which has been really a different level of conversation, but just getting to know each other on that human connection and that human side, and knowing that we all have many roles and aspects of our life that we bring into the workplace, and as a nursing executive we learn from each other each and every day, which is really fantastic, and it also supports when we come through challenges. So because we have these relationships where we do know each other, I feel in a little bit more of a deeper way, when we are faced with a challenge or a really critical conversation or a difficult decision, we approach it a little bit differently now. And we are able to have those critical conversations with us that then we can move through, make the decision together, and still come back the next day and work effectively with each other despite the challenges. So it's been great to be able to do that.
Okay, and on that note, we're probably going to bring this to a close. I just wanted to say thank you to you all, Kate and the team. A fabulous strategy and piece of work, and I'm sure that they'll be very happy to share that with you. They've already put it onto the link. I think what we've heard is a lived strategy. I think it's been about having that foundational piece, going sort of building on what was already there, a very solid framework and piece of work, taking the time, and I think that's come through to really engage with people, really understand each other, and find that space. But not only that, it sounds very much, and it's very obvious to me that it's a strategy that you live day to day. So you should all congratulate yourselves on that as well. Such an important focus. And Fiona, again, thank you so much for joining us today. I've taken away some really good messages there. It's always good to revisit and to think about how we are in the world, how we engage with each other, but also celebrate the real difference that we can make as individuals and as teams. So thank you all. I'm going to hand over back to Anne-Marie. So it's been a pleasure talking with you this morning, so thank you.
Amazing, and a big round of applause, please, from everyone. Big virtual round of applause. Thank you, Jacqui. Michael, who you can't see in Jacqui's room down there, Michael, for really helping coordinate today's session as well. Thank you, Michael. Fiona and the team from Southeastern Sydney, particularly with your short notice accreditation this morning. What a absolutely positive, memorable and wonderful way to launch our week. Fiona, your statement that kindness is a lifeline is in a very stressful situation really resonated with me, and I'd really love to encourage everyone who's online to, have a think about, or if you're even brave enough to share in the chat, what have you heard today, and what's resonated with you, or what is that one small thing that you might take back to your department or ward or house today to create a kinder environment for us all. As Susan mentioned, there's a wonderful program underway, not just in New South Wales, but across Australia and globally. And We have had a long and beautiful partnership with the Hush Foundation, and you've probably seen in the chat Professor Catherine Crock and key architect Lucy Mays and Laura have joined us this morning, and we're incredibly grateful for your for the partnership that we've had with you guys over the last number of years. And so if this session has whetted your appetite, not even sure if that's a word, today at 12:30, the Hush Foundation will bring you Structural Kindness, Working Smarter, Not Harder. With some of Australia's leading minds, we'll explore the balance between policies, procedures and the human factors shaping healthcare. Tomorrow at 10 o'clock, we present the Great Conversation 2.0. If you joined us last year, we had the great debate where the fabulous Nikki Macklin will again lead a conversation with lived experience occupational therapist Emma G and Professor Richard Frankel, and they will together explore the great question, is kindness really a superpower? As Susan mentioned, she's going to be sitting down in conversation with Associate Professor Rebecca Deans on World Kindness Day. And also, if you work at 1 Reserve Road, please join us in person in the foyer from 12 p.m, where Susan will launch the arts framework, and there'll be some really fabulous craft activities, and you don't need to be an artist, where you can make your own kindness superpower cape. And on Thursday, please join us as we celebrate 12 months on from the fabulous launch of Kind Lab last year, where we put a spotlight on our winning pitches and in particular the Kind Side podcast. On behalf of the team, I'd really love to thank you for giving up your incredibly valuable time today. We have a short evaluation that we'd love you to take the time to complete. If you are going to join us for the rest of the week, you don't need to fill in today, but if today is the only day you're able to join us, we'd love it if you could provide us a little bit of feedback so that we can continue to provide the conversations and the opportunities that are meaningful for you. So have a wonderful Gathering of Kindness week. I got my first photo this morning from Wollongong Hospital in the peri-op area, where we had staff in the Wollongong theatres suturing hearts for the Gathering of Kindness. So it's alive and well, where there's lots of activities, not just virtually, but we're really proud to say that our local health districts are really embracing the Gathering of Kindness. So on behalf of myself, my fan team, Maddie, Kirsten, Megan, and the rest of the brilliant team, Kat, who's been driving the chat today as well, thank you so much for everything you do every single day. It definitely doesn't go unnoticed. So have a fabulous rest of the day, and hopefully see you at 12:30 for Structural Kindness, Working Smarter, Not Harder. Take care, everyone, and bye-bye for now.